Hi, good morning. I will going to perform an assessing the thorax and the lungs assessment. So, first, included the posterior and the anterior thoracic assessment. So first, I will going to introduce myself and verify the client identity or explain to the client why it is desired appropriately. So, good morning, ma'am. My name is Jen L. Orlenida from BSN 11H. I am your nurse for today. So first, ma'am, I will going to explain you about the assessing. So first, I will going to perform assessing you about the thorax anterior and posterior thorax lungs assessment. So, ma'am, good morning. My name is Jen L. Orlenida from BSN 11H. I am your nurse for today. So can you please introduce yourself? Okay. Age? Okay. So ma'am, what do you want to call you? So after that, I will going to review the medical record of the patient. Okay. Okay. Also, the patient medical record as normal, no history, background of the his or her medical record. So after that, I will going to perform hand hygiene to ensure the safety of the patient. So next is I will going to close the curtain for our privacy and comfortable to the surrounding. So after that is we will need to proceed the first assessment. So first is I will going to inspect and palpate the shape of the body or symmetric of the cervix of the body of the patient in the back posterior thorax. Next is I'm going to inspect the patient shape and symmetrical of the body, the posterior of the patient. So, first, say talikod. Talikod ra, talikod ra. Talikod laong, talikod. Okay. 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 The patient posterior is both symmetrical and no lesions, no scars also, and titira ka lang na, and also no tension. The findings of the anterior chest is normal, and palpate the anterior chest for respiratory exclusion, it's normal. And the next is the tentacle peritus in the same manners as the posterior chest is I will going. So next is I'm going to palpate the posterior of the body of the patient. Like this. The findings of the patient is also normal. No, move away my both hands, left and the right. So after that, then compare the interior diameter, transverse diameter. After I provide to inspect the spinal alignment for different of the body, the position we need to observe if there is changing or there have both right and left from the lateral position and the observe the normal curve, the cervical, thoracic, and the lumbar or the spines is normal aligned. Lang. finding of the patient is also normal, and when I palpate the chest posterior of the body of the patient is no tender, no swelling, no lesions, and also normal. So after that, I will going to palpating. Be use one hand for the right or both hands. So next I will going to first cue because the thoracic going to proceed palpating to the anterior thorax. First is we need to inspect breathing or observe the pattern. So we need to inspect deep and outside breathing for the interior and the. So next I will going to palpate the costal enter in the angle at which the lobe degree or their spines of the costal is also degree and last hand. No, hand. The findings of the patient is also normal. Again, symmetrical. And after that, I will going to palpate the chest after assessment. That's all. The I will. After all my procedure are performing, the findings of the patient is also I will going to document the finding of the patient. That all for today. So thank you.